So, Dr. Rapaport, good morning.
John, as always, you are fun to be with in the morning.
I would disagree. We're tilting against windmills here. We're going up against the establishment with little efficacy. Our wins are micro and they're one at a time. But I just was thinking about, this is the day following the execution of the CEO of United Health. And I was, on the message boards and reading X and all that, and they're saying it could be some disgruntled patient that was denied care. And I hearken back to your comments about the eczema and psoriasis drugs that are very, very expensive. And I'm wondering, the television creates this world where people are perfect, right? You talk about jumping into the swimming pool with perfectly clear skin and your life is wonderful if you're on this $30,000 a year drug. And
$48,000.
Yeah, $48,000. And some healthcare company says no, right? That's going to drive you into a frenzy. I mean, is this
anger?
Are we creating?
I'm entitled.
Well, that's right. Are we creating this environment where it's okay to start shooting, industry executives on the insurance side because you're being denied what's being promised to me on TV? I'm going to get a strike. I think I'm supposed to say unaliving. We're unaliving industry executives. I just think we're creating this false narrative of medical utopia that's just not viable.
Well, it seems like we did not discuss this before. We
didn't.
Here.
We didn't.
So we're both in the same mind framework. Anger. We're angry at what's going on. We're angry that people are still suffering. We're angry at articles that are being written. We're angry that false promises are being made. We're angry that millions are being made by these drug companies and the patients are not cured. It doesn't matter because as long as they buy my drug, we're making money. Who cares? So we're angry, and I think it's time for us to vent our anger and tell the public out there, whoever is watching us, and I hope there are a lot, we're going to try to protect you.
But they're still taking Dupixent. There's people that know damn good and well who you are, and they're still injecting Dupixent.
That's where our anger mounts.
I mean, how? But
no matter what we say.
I get the person that's not connected and hasn't heard of Dr. Rapaport, and they're hearing it for the first time. But there are former patients of yours that are injecting Dupixent, and they quit coming to you because they didn't have the money to have you in their service. So now they're taking it.
It's my fault.
Yeah, of course it's your fault. Yeah. But now they're taking Dupixent and they're miserable and they get on TikTok and the comments say, have you tried cold atmosphere plasma? Have you tried a gluten-free diet? Or I have an acupuncturist that's going to fix it.
Well, and the reports from them via the internet when they write in is, I'm a little better. What does a little better mean? Plus, and I'm going to try to broach this here quickly, I don't know what phase they're in. They could have one little hive and they're put on Dupixent. They could be covered from head to toe red and put on Dupixent and everything in between. So when they say I'm a little bit better, what does that mean?
Yeah.
I'm eating a little less.
But you know what? That's what the advertisements say.
That's right.
Some improvement.
Well, look at that guy in the pool mounting his cheeseburgers up. It's a ridiculous ad. And a little kid jumping in. There's no rash, but look how happy he is. With what? Because he's jumping in the pool, not because of Dupixent. But they're making millions. Therein lies my anger. And I'm coupled with you on that. So we're going to.
Well, you're a little bit more infallible than I am. My response is say, hey, you know what? You people go figure it out by yourselves. Go to Thailand and get your cold atmosphere plasma therapy. Once you've been presented the information in as many different angles as you have, and you still choose to believe in patch testing and a gluten-free diet, then that's on you. That's on you.
It's hard to come up with a good answer for you. There is no answer. And you're right. The problem starts with that I'm entitled. I live in America. I have insurance. I'm not supposed to be ill. I'm also entitled to take off a couple weeks, couple months from disability because I have a bad rash. I'm also entitled to go to any doctor I want to. I'm entitled. Well, I'm not really totally cured, but I'm better. I'm feeling better. What do you mean you're feeling better? Why are you giving credit to this drug and giving them money? How do we change the psyche of these patients? We can't. This is just our area. And there are thousands, so it's a big number of people. But how about the backs? How about the chest pain? How about the arthritic pain? How about the multiple areas of medicine where they're still suffering because they're believing some advertisement, and the doctor has just been talked into prescribing the newest drug on the market by a drug rep who has nothing but propaganda to spew out to them, and they write the prescription because there was a free lunch attached for the whole staff. It's despicable.
Well, it's despicable. It's despicable if, insurance companies are starting to make decisions and it's inflaming people to the point of, doing some really bad things because they're denied care for drugs that may or may not work.
If this is pertinent, and I think it is, just a couple days ago, a writer to my Facebook from England, and this has occurred a few other times in slightly different verbiage, said, "I'm so glad I live in England and have free medical care."
Yeah.
I wanted to say, you wait 6 months to get your hip
They
fixed.
don't know the difference.
They don't know the
They
difference.
don't know the difference.
Because they've been brainwashed for
Yeah.
80 years
Yeah.
to believe that this is the best.
Yeah.
My doctor doesn't, that drug is not on the formulary. It's got to be evil. Some committee decided that. No, I've treated 1,000 people with that drug and they're all cured. No, but they believe. It's like a religion and they accept it.
Well, and the media, the broadcast media, and people they've gotten you've gotten their attention, always feel compelled to do a balanced article. Here's this nut job out in Beverly Hills, California, that's a no steroid extremist and says quit cold turkey, and that's the sole summation of your problem. Okay, that's one side. The opposite side is, eczema is a complicated thing. We've got these biologics, we've got Dupixent, we've got these other drugs, and somewhere in the middle is the truth, which is bullshit.
And you fail to recognize or mention, we're paying the bill for the insurance. Our premiums go up because of this.
100%.
We're paying them. So you were entitled to be angry. My rationalization, because it's been decades of trying to get the point across, my feel-good feeling, momentarily only, is that I've cured 10,000 people. Not lying. You can look at my records.
No, of course.
Okay. So it's obviously true. And if I make the next patient better, I feel good. One patient at a time is the best I can do at this moment. And then there's somebody who writes on the Facebook that, I listened to you 10 years ago and I've been clear and free. Great. How many of you are out there?
Well,
how many?
I have not seen one scintilla of evidence that Dupixent alleviates the symptoms that are exhibited through a withdrawal cycle. Not one. And there's certainly been no testing done for that. But yet they take it religiously.
We will talk either in this tape or the next about articles that were published.
All right, well, let's go ahead. Let's make this a longer video, and we'll have a longer attention span and ask our viewers
or I can end with this.
No, keep going.
Whatever.
Keep going.
The articles that I'm going to talk about, which are outrageously falsified, and the patients are on these drugs, all were tested on topical steroid addicted patients. There are no bad eczema patients who are past 8 or 9 years of age. There are no patients who have not been put on steroids and have not become addicted. They're testing the wrong diagnosis. I will reiterate for the 700th time. TSA has a different biopsy, has a different presentation. They're red. Eczema people don't get red like this.
Is there a TSA biopsy? Is there a biopsy that indicates
the biopsy is
TSA?
different than a biopsy of eczema. And the burning sensation that the TSA people have, no eczema patient has that symptom. They're different patients. That's who are involved in the studies. The other thing, which is horrific, outlandish, and I have done research for a long time at UCLA. I have done human research carefully only if I know the medication or item or procedure is good and accurate and the preliminary data shows that. I will not expose a human being and hurt them. These, I'm sorry, SOBs, the doctors, in each of these articles, there are 30 or 40 doctors contributing their patients repeatedly for every new drug that comes down the pike. They're using their patients as guinea pigs.
No, I get it. I get
That's
it.
not nice.
Well,
it's inappropriate.
Okay, now what?
Put
So
them in
what?
jail. Put them in jail. Criminalize them.
You know, we've got topical steroid addicted patients signing up to ITSAN to become available for research, and you know these drug companies are reaching out to them and involving them in these studies.
They'll give them some money so they can travel. ITSAN, and this woman who had a film, Brianna, self-aggrandizing herself because she had the disease. It's money. It's always money. Money, money, money. And the drug company is laughing. Laughing. I told you, and I'll say it for again the 10th time, Regeneron, who makes Dupixent with Sanofi, Regeneron's board received $27 million last year. They donated $27 million to themselves.
Well, why not? I mean, Marvin, they're not lying to anybody. You read the disclaimers during the television commercial, and it tells you exactly what's going on. Some improvement in sleep and some improvement in scratching. And by the way,
that's it.
And by the way, you got to stay on topical steroids to have the most efficacy with the drug.
Right.
So what? I mean, you know what? God bless them. God bless them.
How can you say that?
Well, Marvin,
you're helping criminals. They're criminals.
Are they?
In my mind,
it's full disclosure. They're disclosing. But the guy in the white coat walks in and says, you need to take this drug. And they go, yes, great, thank you. Or conversely, the people watch the commercial and say, I want this drug. And they go to see the guy in the white coat and they go, great. Here's how you do an injection. Keep it in the fridge. I'll see you in 2 weeks.
My colleagues in the white coats are getting something.
Of course.
They're getting a free lunch, a free dinner, a trip.
Okay, so now we're to Robert Kennedy or RFK, right?
He could be right in a lot of things. There's a lot of garbage that's been going on for a long time in the NIH everywhere.
Yeah.
The NIH has sponsored all kinds of faulty research, given monies to who knows whom.
All right. What's the point of this video other than you and I raving and ranting? That we're living in this
Maybe 3 people will watch
in
us
this
and get angry.
matrix of drug sales and misery perpetuation.
Okay, then I will finalize for the moment. Say absolutely, Mr. and Mrs. America, who have TSA, not bad eczema, you are getting the wrong treatment. Stay away from Dupixent. It has multiple side effects in the eye. It does not work. No one has been cured, and I will go into one of the articles that was published recently. Stay away from Rinvoq. It has severe side effects. Stay away from all the new ones that they're going to tout in your doctor's waiting room to them to use and to compete with Dupixent because the money is there. Why not have another drug that makes more money? I'm telling you, stay away from those. The therapy, you have TSA, is stop the hormone called steroid.
I have a friend who clearly is steroid addicted. And he knows me very well. He knows what I've been through. He knows of you. He's seen the movie. He's watched the videos. And the guy's miserable. He ends up in the emergency room, not infrequently getting a shot of Kenalog. The guy's miserable. And I bring it up to him. I go see Dr. Marvin. Go start doing all this. I'll pay for it. Just go see Dr. Marvin. And the response is, I spoke to my dermatologist in Temecula, where the hell the guy lives, not to besmirch Temecula, and he says, I don't have that. So this is a guy that's got the information. He's empowered. He knows soup to nuts what Dr. Rapaport is saying, goes to his dermatologist, who finger quote knows him, and the dermatologist says, no, you're not addicted to topical steroids. So in that environment, how is it possible to move forward?
Well, then I corroborate everything you say with the word addiction. The opioid guy, the alcoholic, the amphetamine guy, they're all addicted. The cigarette person, they're addicted. It's very hard to come off an addiction. They refuse to suffer even a little bit. They're not strong enough. They're very weak.
But they don't have to.
They're addicted mentally in the brain. Those people. These people are addicted in a different way. And when they suffer, they go to the medicine that makes them feel better for a moment. What happens with all addictions is they run out. It doesn't work anymore.
That's what happened to me.
Doesn't work anymore.
That's what happened to me.
Doesn't work anymore. But they refuse because it takes effort, hard work. It's very difficult to give up an addiction. Do you think the success rate for alcoholism, for opioids, is that great? They kill themselves. That's the success. They die.
Yeah. Yeah.
And the problem's over with.
Yeah.
And they do die.
Yeah.
Well, these patients don't die. They just keep on suffering.
Yeah. Yeah, you're right.
So do we have to take another approach?
I don't know.
Not be logical?
I'll leave it up to the comments. I mean, we make these videos occasionally. We rave and rant. And, we just had a big article published in the Epic Times. Jeremy Tsai, she interviewed you for a couple hours. I was with her for 45 minutes. She interviewed a number of people. The article finally got published after the editors went out and said, you got to go get the other side. We're not going to hang the credibility of Epic Times on this crackpot Marvin Rapaport out in Beverly Hills. Get the alternative view. So we found the Harvard doctor, and the Harvard doctor, oh my God, don't get me started.
Yeah. Well, I the best I can say is we vent here.
Yeah.
We feel good.
Okay.
We'll go and have a coffee and some cake. Right. I'll take care of one more patient, maybe, and I'll cure them. I'll feel good for the moment.
Well, it can't
We'll
go
keep trying.
it can't go unrecognized that we both collectively and individually get comments where people are like, "Hey, thank you, I'm off. I rejected all of the propaganda, and I'm better. It was a long road, and thank you." So if we get to one, that's beautiful.
I think it's the best we can do. We have talked to each other about what's our next step to improve our results. It appears that we've run out of other avenues other than yelling and screaming and calling them SOBs and bastards who are doing research and sharing their patients as guinea pigs, not treating them well, about the drug companies who are evil. And we shrug our shoulders.
Well, and to your point, you're seeing our articles in JAMA, and you're enervated about that. So am I. But it doesn't negate the customer or the patient. There's no difference, by the way. Walking into the doctor's office saying, "I want XYZ drug," and the doctor saying, "Great, hand me my pad."
But you and I are unwilling because of our personalities to give up. So we keep making these tapes. We have a lull period. We back off. We say we're not going to get involved anymore. And then we attack again. It's, are we to be commended? Are we to be chastised? I'm not sure. We chastise ourselves enough. I think we should keep trying. We have a good time. We're getting some ideas across. We're reiterating. There are new people who look in on our tapes, who read the Facebooks, who have never been exposed before. They're new because they keep getting addicted by their doctors. New people keep getting addicted.
The tragedy is I see people suffering who I've communicated with directly, and the information that I'm presenting is rejected. It breaks my heart. Their ignorance breaks my heart.
Well, I'm going to tell the audience that one of the pleasures that I have received in the last multiple years is curing you and watching you be a normal human being without scratching, without being red. And you've forgotten all the
No, I haven't.
travail you've gone through.
No, I haven't.
But you went through 27
Yeah.
years of
Yeah, I'll never forget.
ordeal.
I'll never forget.
But it pleases me that you're well.
Well, thank you.
So I'm happy. It's the best I can do. And we've attained a friendship relationship. And we're trying our best to help others. And I think that's all we can do. I can't get a megaphone. I don't have a microphone. And with some, four-wheel van driving through the neighborhoods, we're not going to.
It wouldn't matter if you did. I mean, we've got patients that have seen you that are now not seeing you and taking Dupixent.
Yeah.
It's and aren't better, by the way, and are on TikTok complaining.
I maybe in the next tape, let me tell you about the article.
Oh, God, Marvin, nobody cares. I mean, you can talk about it, but nobody cares. It doesn't matter. I'm not discounting your research. It's who the doctors are going to do their thing. JAMA's gonna publish
because they'll get advertised.
Yeah, they're going to get advertised. I mean, it's we can wallow in all that, but it's moot.
So, are we in the hands of scalawags and scoundrels?
No, I think possibly.
No, we are. We are.
Yeah, I mean, again.
So, if those are scandalous, then the NIH they're wonderful. They're saints. Then the hospital over here, Harvard or Cedars of Lebanon, is wonderful. No, they're all the same. And it's very distressing.
Well, I have a friend who used to say, he's no longer with us, he said, there is the truth, and there are the facts, and they aren't necessarily the same thing. And I think that encompasses pharmaceutical advertising and kind of a mass sales process to a T.
I get happy when I see a mattress advertisement. I know they're. What's the worst that can happen? You're uncomfortable on the mattress. But with the drug company, wow.
All right, we're at 25 minutes. We probably lost everybody. but as always, thank you for your time. And let's
John, you ask the right questions, and I'm glad to be your friend.
My head's
so glad to have made you better.
Oh,
it
that's right.
Me.
And see, that's part of my frustration. I see what can be with these people that are suffering, and the fact that they reject it just makes me crazy. You know, I'm an evangelical non-steroid user.
Well, if it's any pleasantry involved, maybe the film that we made with Keach, Hollywood film, 124,000 people have viewed it. Our tapes appear to be garnering anywhere from 1,000 to 3,000 or 4,000. They keep on getting viewed because I keep a record.
Yeah.
It pleases me to see the numbers grow. But there are tens of thousands out there in the whole world who are still suffering.
You're unquestionably the authority on this subject, and by far you're getting the most views and most eyeballs. The question is it impactful? All right.
John, thanks.
Thank you. We'll leave it there.
Okay.
All right. Like, share, and subscribe to these ravings and rantings. Thank you again.